Check the mic and make sure it sound right, boys. It sound right, boys.
Boom, 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 boom. This is Jared, and I'm back. Hey guys, man, I'm super, super excited to do this show tonight. All right, we have got a great, great show tonight. All right, I'll be showcasing, spotlighting, all right, Matthew Novelli from Texas. All right, you know, he's been on my show before about a month ago, and we're going to hear more about his kidney journey and how he's doing right now. All right, so he's had fistula surgery, and we're going to hear about how the fistula is maturing, and we're going to hear a little bit more about what's going on. All right, I've got a good co-host. All right, my co-host has been on the Warriors Quest show. She was on, I believe, like December of last year, 2020. And since then, all right, she's gotten a kidney transplant surgery, and she's a recipient. All right, she's been a busy bee. She also has written and authored a book called The Purposeful Positivity Journal. So I'm going to be having a co-host come on tonight who's been on my show previously, who's now a transplant recipient. He's authored a book. So technical difficulties on my end or on her end. I'm not seeing. Looks like I lost her. Hopefully she'll come back. But here is her book, everyone. I'm going to show you all her book. All right, buy this on Amazon. All right, buy this on Amazon. Here we go. So it's the Purposeful Positivity Journal. All right, and where you can find this on Amazon, I'm going to show it right here. Here we go. Here we go. I'm trying to show it. I don't know. It's not coming on. There we go. It's slow. Here we go. The Purposeful Positivity Journal. All right. That's the link. You can find it on Amazon, even if you search as the Purposeful Positivity Journal. All right. So hopefully, if she can hear me, log out. Try to get your connection good and come back, because I want to bring your story about what's happened, and I want to bring you back on. So hopefully, I haven't lost my co-host much longer. But in the meantime, until she comes on, all right, I want to say I'm your host of the Warriors Quest show. Of course, you know what time it is. All right, this is the Warriors Quest show. We spotlight a warrior every single week, okay? A chronic disease warrior who's looking for a living donor. So again, today we'll be spotlighting Matthew Novelli from Texas. And I've got my host. I think I got her now, so I'm going to bring her on and showcase Matthew Novelli's kidney donor search. All right. Okay, so I'm going to bring her on and give her a very Warriors Quest welcome when she comes on. Here we go, VIP co-host. Where is my co-host intro? Co-host. Hey, how are you? Can you hear me okay? All right, so hopefully out the technical issues with my co-host. I'm going to leave her on. All right, I'm going to leave her on so that she can hopefully get connected and everything will start working well. Can you hear me? All right, so I'm going to keep you on, and hopefully you can get that connected well, and that we can get this going in a better direction so that we can interact. Because right now I just can't hear you well enough. But in the meantime, I'm going to bring on our very, very special guest. All right, his name is Matthew Novelli from Texas. All right, this guy's been on my show before about a month ago. We're going to bring him on and we're going to hear more about his story. So please give him a very, very warm Warriors Quest show welcome, Matthew Novelli. Here we go. VIP intro. Here we go. Boom. Hey, Matthew.
Howdy.
How are you,
Howdy.
Matthew?
Pretty good. Pretty good. Thank you for that introduction.
Hey, it's good to see you, brother. How are you?
I'm good. I'm good. How you been?
I'm doing really well. Hey, so thank you for coming on to the Warriors Quest show again.
Yes,
We're
sir.
playing music here. I just switched places here. So, Matthew, man, you were on my show about a month ago, and I wanted to bring you back on because in a month's time, a lot has been going on. So, what I'd like to do is just put you solo and talk a little bit about what's happened within the last month. You on the show, okay?
Yes, sir. Yes, sir. Yeah. So as far as what's happened, I had a fistula procedure done, and I'll kind of show you. Well, they actually used it today to access it, which they do with needles, and I can, I guess, go into that in a minute. But I had a procedure where they took an artery and a vein, they put them together, and then after that, a month or so later, they did another procedure, and I forget the name of it, but they actually brought that artery vein connection closer to the surface here. And so that was, I mean, that was a couple months ago. So it had to mature, and now they are accessing it with, they'll use a needle, 2 needles, one to take the blood out, and then it cleans it through the machine, and then another needle to put the blood back in. They're using 17 gauge needles. I just found out today that I've got, after a week of this, I'll be graduated is what they call it. And they'll be using a larger needle, which I believe is like a 16 gauge, which I'm not super excited about. I'm not super excited about needles, but it's part of it. And I've been told also that I will be feel better overall. I guess the overall dialysis treatment, I'll be getting more. It'll just overall, I'll be feeling better because it'll be working more efficiently. So, but yeah, I've that, and then I have some other, I think, sort of exciting news, if I could share. My beautiful wife has went and got screened to be a donor last Thursday, and so I went with her. They did some testing, drew blood, EKG, a CAT scan, I believe it was, and we will find out the results of that on, well, they said it could be about a week or so. So again, that was last Thursday. And so yeah, she is the same blood type. So there's that. I get excited, and then I don't want to get too excited because I don't want to, just be expecting whatever the results may be, good or bad. But I love her so much that she was even considered doing it and going through the process. And if anybody ever wants to know what the process is for becoming a donor, now I have a little bit of experience in what she's gone through, and I'd love to share it because I've had people ask me and I just didn't know up to this point. So yes, sir.
All right, so hold on. Hey, so man, that is great news. Congratulations. That is
Yes, sir. Thank
awesome.
you.
I hope that your applicant, I hope that your candidate that has come forward, that the testing continues to go in a very good way. So man, Godspeed, and I hope only that things go swimmingly. That's awesome news.
Thank you, sir.
So I wanted to talk a little bit about the fistula. So one of your videos, you were very candid. In fact, a video I think you may have made yesterday, you were pretty candid in showing your fistula. Do you mind showing that in tonight and showing folks what it looks like?
Well, so yeah, on that though, because they did use it. They used it tonight, so they bandaged it. So there's not. I guess you can kind of see, but
Right.
and you can kind of see that vein artery that they connected, which is at the surface. It's weird looking, and it actually I can feel it. They call it the thrill. And nothing thrilling about it, but I can actually feel the darn thing, like when I put my hand on it, or sometimes when I'm just not even paying attention, I feel this because it's like a whooshing of, I guess it's blood or whatever that's going through the darn thing. And yeah, I mean, maybe at some point I'll do a video again, and without the bandage, you can see it better. But I mean, right now they just have it bandaged up. And they want it to be bandaged for a couple hours. So yes, sir.
All right. So the thrill, you're continuing to feel that. And that's really important because then that's a good indication that it's working. So what other kind of care have they taught you and how to make sure that the access point is clean and stuff like that?
It's don't lift anything heavy. And I don't know, they may have told me a number, what the heavy is. And I mean, I don't lift heavy stuff to begin with, so I don't think that's going to be too much of an issue.
Right.
I mean, I just keep it. Or when I go in to the clinic, that I wash it with soap and water. And one, I guess, like side effect is that my fingertips on this side, they get numb, and sometimes they'll turn white or purple, and it freaks me out because I won't be paying attention. Next thing I know, my fingers are purple or numb, and I'll show my wife. I'm like, it's doing it again, and I'm of course paranoid, thinking I'm going to lose fingers. But she said, just massage it or rub it, and normally it goes away pretty quick. So.
In that in your last video that you made, I can only imagine, man, that must be a little bit. That must be very alarming. Does it feel kind of when that happens, like that tingling feeling, like maybe fingers have gone numb, or
Sure, absolutely. Like if you've ever like laid on your like fallen asleep and you wake up and you were on your arm or something and it's numb like that. It's that. Then there's tingling when it comes back, or sometimes it's yeah. But that's pretty much what it is.
all right, all right. So Tanisha, thanks for watching. Tanisha, she's saying it's called the Steele syndrome. Okay,
Oh,
so
okay,
that's
yeah.
interesting. I've
Thank you
heard
for
of
that.
other kidney warriors having that issue. Of
Mhm,
course, like you mentioned already, that it's because of the blood pressure thereof, not on that in that
mhm,
area. But that that
mhm,
that would be very alarming. I don't blame you for having that freak you out. That's got to be
mhm.
it's got to be a little weird, right? Awkward.
Well, especially the first time it happened, yeah, because I wasn't expecting it, but yes, sir.
Yeah, right.
Mhm,
So, so I'm going to bring up a little bit of a graphic here. It's not too graphic, but so
mhm,
here's the photo right here. Is that I want to bring it up. So here it's just here we go. It's coming up slowly here, but here we go. So the AV fistula. So for a lot of the kiddos that are watching right now that either have a
mhm.
fistula right now or had one, understand this a little bit, but how doctors explain to you, Matthew, how the fistula works and how the blood, how that access point will work.
Right. Well, it was explained to me that hopefully I got this right. I feel like I should. A vein and an artery are connected together, and so they, in because again, it's they access it with two needles, and so both
Hmm.
the needles can one for taking out and removing the blood, and then the other one for putting the blood back in once it's clean. And I guess it's just it's an ideal way to do it as opposed to because I've still got this chest catheter and I just learned this the other day. This is not I heard it's risky because I guess there's a kind of there's an open area, right by the heart. So that I got, but then they were saying this is not very efficient, the chest catheter. Whereas the needle is, or the fistula is more efficient, but then they said, well, when I have a bigger needle, using bigger needles, because more blood flow is able to, to happen during the
Okay,
cycle, whatever you
right,
want to call it. Whereas I'm using the
gotcha,
smallest
right.
needle, which to me, I was like, okay, at least I'm doing this. And like, no, again, they're talking about graduating me to a bigger needle, and I don't know how big they're thinking, but I'm just like, when I hear needles, I gotta zone out because I do not like needles. But yeah, so
Yeah,
I've been you're right, and I've been doing the using this access here for about a week, a little over a week now. So yes, sir.
all right. So it's matured well enough that you've been using that it's been working. You've been using it for the last week or so.
Hmm. Hmm.
And the way you put it, hooray! I've grown to two needles.
Hmm. Yeah, and I mean, but it's I don't know. It's part of what needs to be done, and I have as long as I don't look, that helps. So I mean, if anybody has to go through this and they've not accustomed to needles or just shots in general, don't look. That's been like my best like helpful hint in all this so far.
Okay.
Mm,
All right. So hint though, that's a good tip. I like that. Look, because I got to tell you, that's probably the best for me because
mm,
you know I I don't do well with blood, and so it's
mm,
something that I've had to get used to. That's something that I would if I were because I probably wouldn't look.
right,
But
right,
anyway, yeah.
sure, right.
So I'm trying to bring our co-host back. when okay, can hear her. Hopefully we can get the technical difficulties resolved so that she can interact with us as well. Can you hear us okay?
I can. Can you hear me?
I can hear you. Yes, ma'am. Mhm.
Yeah. So what we may do is just kind of we may need to move your camera because we're seeing the top of your head right now.
Okay.
Better?
What about now?
That's good.
Okay.
Yeah, that's much better.
Finally,
So
I'm here.
yes, thanks. All right. So I'm going to trade us places a little bit. And let me see if maybe we can do this a little bit differently. So let's have our co-host, if you would. Could you try to have your phone positioned like a landscape mode instead of portrait, so it's not so that it's kind of like sideways. Phones, unless it's an iPhone. If you got an iPhone, sometimes they're a little more stubborn. There we go. Perfect. There we
Okay.
go. Perfect. So it's a full screen. All right. There we go.
Okay.
All right. Great. I was yeah. So Steve
I
was
was
just
listening to
asking me to just show that.
everything.
I knew you were.
Yeah.
Yeah. So asking if I showed the chart. Yes, I did put the chart. I'm going to put it up one more time. So welcome to our broadcast. I've got my co-host here. I'm going to allow her just a moment here to introduce herself because of technical difficulties. So I'm going to let her go solo just for a moment and have her introduce herself. Okay.
Yes, sir.
All right. Go.
So, hello everyone. My name is Shalia. I am a kidney warrior. I've been a kidney warrior since 2015. I was on dialysis for 6 years, and I recently celebrated my 4-month anniversary of a kidney pancreas transplant. So things are going well, and I'm just excited for the future. So that's me.
Awesome. Thank you for that. So last time I checked, okay, you were from Philadelphia, Pennsylvania, but you're in Georgia. Is that still the case?
Yes, I am in Georgia. So I was on the transplant list in Philadelphia for 5 years. Um, and I recently moved to Georgia.
5
And because
years.
I
Okay.
because I had moved to Georgia and it was COVID, my transplant coordinator was giving me a hard time with traveling back and forth from Pennsylvania to Georgia. So they didn't want to put me on the list anymore. So one of the doctors at the dialysis center in Georgia said, I know you've been waiting 5 years, but maybe you should get on the list here. I got on the list here in May and I got my kidney pancreas in July. So I was not expecting
Oh,
things to
wow.
come as soon as they did, but
Yeah, that's
it
awesome.
happened. Yeah, yeah. So had I still been
Well,
waiting for
praise God.
Pennsylvania,
God.
yes, praise God. Yes. So yeah.
I just want to say
Awesome.
congratulations on the kidney transplant. That's so cool. Shalia, nice meeting you. My name's Matt.
Yes, nice meeting you too, Matt. And
Yes, ma'am.
your journey, I've been there.
Mhm.
I have 2 fistulas
Oh, okay.
and I've had 3 chest catheters.
Ooh,
So I know what you're going through personally, and
you know what it's like.
yes, I do. I still have my fistulas in. I don't know. One of them I may get out because it's not working anymore, but the other one I'm kind of scared to get out
Mhm.
just because I don't know. I want to wait for a few years to make sure that everything is okay. I don't want to have to get the fistula out, and if anything goes wrong, get another one put in because
Mhm.
it's a lot.
Mhm. Mhm.
Yeah. So
The fistula surgeries. For the most part, we're okay. I mean, I guess the recovery. Did you have to have 2 per fistula, 2 surgeries? If you don't mind me asking.
2, no, I
Okay.
didn't. I had 1, but I had to wait for them to mature.
Okay, I did 2, but they did 2 surgeries where it was the one where they did the fistula initial surgery that connected the vein and the artery, and then they did another one where they brought that, I guess it's called fistula, up closer to the surface. So they
Okay.
wait, like a couple months later, or like a month and a half later from the first, they did that second one, and it's still actually a little bit sore from that second one, but they're using it to for my dialysis. It's an access that they're using.
Okay. Where are you from?
Texas.
Okay.
Yes, ma'am. So Austin, Texas. So and I'm on the transplant list here in Austin. So
Okay. Awesome. How long have you been on dialysis?
God, I want to say like 5 or 6 months or something like that. Somebody was asking me like when I started, and I honestly can't remember when, but it's like about 5 or 6 months.
Okay. How long did they tell you the waiting list was if you were to wait for a
Right.
donor? How long is the waiting list?
5 to 7 years
Okay. Yeah,
for
that's
a deceased donor. Yes, ma'am.
That's what they tell
that's
everyone.
about average.
Mm-hmm.
Yeah. But you see, I'm in Georgia, and I got on the list in May, and I got my transplant in July.
It sped
awesome.
things up.
Yeah.
Yeah.
And see, I don't know if okay, so I had a transplant back in 2004, and I was on the list there for 2 years, and it was a deceased donor that I got the kidney from, and so I don't know if things have changed, if the list, the wait's longer or whatever. But when they said 5 to 7 years, I remember thinking in my head, going, "God, that seems like a long time." But if that's what I
It seems
need
like
to
a long
wait for,
time.
that's what I'm going to wait for. But when I was on dialysis before, I actually had a chest catheter then, just on the other side, and I actually had that the whole time I was on, because they tried the fistula surgery and it didn't take. So
wow.
I ended up being on dialysis or using that chest catheter for the full 2 years or whatever that was.
Wow.
Mm-hmm.
Well, I'm glad that you didn't
Wow.
have any problems with it, because 2 years. Yeah.
Yeah, I just thought this is what I'm going to be doing, and I didn't think anything of it. And my wife just messaged at the board here that it's been 10 months. I've been on dialysis this time for 10 months. Yeah. Whew, time flies when you're having fun, right? So.
Okay. Well, prayerfully, your wife is a match, and that process can take place.
Yeah. Well, thank you so much, and we'll see. Hopefully, the next day or two, next couple days, we'll find out, what those results were for the testing. So.
Okay. Well, you have to keep us
Right.
updated. Let us know.
Yes, absolutely. And I plan on, if I'm able to get back on the show or whatever, I mean, I'm going to keep, because, I've been telling people just about anywhere I go, about what's going on, and I don't plan on stopping even when a transplant comes along or a kidney transplant happens. So, yeah.
Okay. Yeah.
Interesting. I want to thank Joel.
It's so good to. No, I'm saying it's so good to get your story out, because you never know. I used to be ashamed to tell people what I was going through.
Okay.
But the more that I told people, the more people wanted to help.
Yeah.
So
right.
it's just always good to get your story out, because you never know who
You never
will
know.
be the angel for you. So
Yes, ma'am. Yes, ma'am.
No, it's totally true. It's totally true. So one of just as an example, somebody on the Warriors Quest show whom I interviewed back in April 28th. So just maybe I think 3 months later, I found out that she got a kidney transplant.
Wow.
And
Mhm.
on the Facebook, they gave me credit that the video, our interview on YouTube, was shared with a potential, and
Mhm.
Wow.
felt after YouTube become a living donor for my guest. And so it does
Mhm.
happen. It does.
Mhm.
And you never know. So anybody who's watching, please don't be stingy. All right. Please share this. All right. Let's get this information out there, because somebody
Mhm.
could be watching tonight. All right.
Mhm.
Who may be inspired enough to donate, because things may move along. And if the donor candidate, for whatever reason, we don't know, okay, what may happen, but if go well, then we need to share this so that other people may step forward for Matthew, and then just raising awareness. You know what I mean? Right, guys?
Right. Yeah.
Mhm. Yeah,
Yeah, so many
absolutely.
people going through this that uh I don't think it's talked about enough. I also don't think that the things that we go through as dialysis patient or as transplant candidates is talked about enough. So,
Well,
Right.
I think
Amen to
I
that. It
think
needs.
and it's not talked enough. When I went through this before, I there was, again, this is 0204. There weren't Was there Facebook back then? I don't remember. I don't think there was, and if there was, I wasn't on it.
No.
And there wasn't these groups that, because I've joined all these groups on Facebook and stuff like that, and I kind of felt alone on it. I mean, I had my family, backing me up, which was nice, but I couldn't just jump on a group and just start messaging back and forth people that I didn't even know. It's like, and it's crazy. Once I started looking up kidney groups, there's 10, 15 of them, and then so I try to join all of them, and I try to share my story there, and then hear other people's stories, and just a way to relate. And it's just it's social media. I mean, it's definitely been a very positive aspect of my life as far as all that goes. So yeah, it's a lot different now, way different now.
yeah, the power
Well,
of
and
social
that
media,
can be very
that's very
good. Yeah, it can be very
Yeah.
powerful. Very well said. It can be powerful.
Can I ask a question of y'all real quick? So
Yes.
did y'all see the transplantation, or when they transplanted a pig kidney? And it was, I mean,
I've heard of it.
did y'all
Yes.
see that?
I didn't
Okay,
I
see
because
it, but
have
I
heard
heard
about
about
it.
it.
I think that, and they have a cool name for it, going from an animal species to a human as far as transplant goes. And I can't think of the name right now, but they did they transplanted a pig, and they genetically they changed it genetically so the antibodies don't destroy it. They transplant it to an individual. It lasted for like 50 something hours, and then they terminated it or whatever. But that they were able to do this, I think, is like this huge step as far as, and I'm sure it'll run into ethical issues and all that. But I mean, just you just think about, I think, the potential with something like that, because however many people are dying a day because they're not getting transplants, I don't know, but there's a number there, and something like this, I think, can be a real game changer down the road. So
Absolutely.
Right.
Absolutely.
Mhm.
No, I think it is something that I hope that they need to continue to pursue, and I hope that there's, so on and so forth, because it's just amazing what they're with technology and so on and so
Mhm.
forth. And if the pig is a match, and it's
Mhm.
successful, then, man, God
Mhm.
willing, I hope that they can continue to get more information, data, so that this thing maybe more people can have done.
Yes, sir. Mhm.
So if you did see that, and I'm going to bring it up again, but we've got Steve is a registered nurse, and he's been in this field for the last, I think, at least years. I may be off, but I think 3. He's saying that they automatically went to the larger veins. However, a lot of people get the access put in the lower arm where the veins are where the veins are small. That's interesting. I'm not.
Yeah, I had my first
perspective. It's a good
fistula on my lower
perspective.
arm.
Okay. 36 years. He's correcting me. Okay.
I had my first fistula in my lower arm, and I used the smaller needle the whole time.
Okay.
So,
Okay.
yeah.
So Matthew, you've used the fistula successfully for the last week. Is that right?
Yes, sir. Mm-hmm.
And how has that been? Have they had problems connecting? And can you talk a little bit about how that's worked or not worked?
Yeah, I mean, knock on wood, they get it every time. I mean, it's a big old like vein. I think you can see it from outer space just about, and like they get it right away. And I mean, it's sometimes uncomfortable because I mean they try to move up and down the arm a little bit, and they were just about getting in my armpit on Monday. So it's a sensitive area. So, and there's a little bit of, and then I have to keep my arm straight the entire time because they're like, don't move your arm too much. It might infiltrate. I'm like, well, what's infiltrate? It's when the needle, I guess, goes from one end to the other. It doesn't sound good. I'm just the whole time paranoid, sitting there going, I can't move my arm. And of course, like today, I wore shorts, of course, with no blanket, and I'm freezing and tingling in my hands. So it's a little bit of a, but it's what this thing is. So yeah.
All right. So I apologize that the graph that I have up here is taking up some of your space. That's not my intention. I tried to move us around so that didn't happen, but I just want to be able to show this graph while we're talking about the fistula. So, with Steve talking about
no, it's okay.
Yeah, I apologize. That's a little bit embarrassing. So infiltration is when the needle goes through the access, causing a large hematoma, is what Steve is saying. So I'm hoping that doesn't happen. You don't get infiltrated, because I hear from other kidney warriors, and maybe our co-host will attest to this if that's ever happened to her. But I hear that can be painful.
It has happened. That's how my first fistula fell.
Oh, right.
My first
Okay.
fistula fell from infiltration. Yes, and they weren't able. It ended up clogging, and they weren't able to get the clot out. So yes, that has happened to me before. But I also think that sometimes you have to advocate for yourself with some technicians, because they will in the same place. They won't rotate.
Because it's easier.
Right. So you have to, once you get to know your fistula and rotate. Like for me, I scar very easily. So they will look at the scars from the needle and say, oh, well, this is where you get stuck at. Sometimes they'll stick 2 needles too close together. So you really have to advocate for yourself and let them know. Because everybody's different. You know your body better than anybody else. So you let them know what it needs to be done once you get to know your fistula.
Speak up.
So.
Yeah, absolutely. Self-advocate.
Yes.
I like that. Sound advice, because if you feel uncomfortable, or if there's any sort of anything that you want to say, you should be able to feel like you can say it directly. Because that's the only way that they, if you don't say anything, they're just going to continue to do it.
Right.
Exactly.
Yeah.
Steve's talking about an aneurysm. We don't want that to happen.
Oh, no, we don't want that at all.
No, not at all. So, man, I appreciate the comments. We've got Tanisha commenting, Steve, of course, which is his comments are awesome because his comments come with such good experience. Joe Ellen, great comment by her. I'm going to bring it up again. She's saying that they used her upper arm based on an ultrasound. Here it is. I'm going to bring that up one more time. They used my upper arm based on ultrasound. My first failed. Second is the basilic vein and had transposition just a couple of weeks ago. I'm about ready to start using it. Interesting. So we've got some great comments in. Keep the comments coming in, you guys. I love it. Keeps this interactive and keeps this broadcast getting. It will reach more people if we get just a slew. Just please, just let's break this broadcast because it's overloaded with comments. All right, let's just keep them coming. Thanks for watching Jonathan Trailer with Hope with Jonathan. Please go to his YouTube channel if you haven't already and like and subscribe. If you haven't already, go to Steve the Kidney Nurse YouTube channel and like and subscribe to his channel. All right. So we've got your wife, Tina's, she's commenting right here, says, Matthew, transposition was your second part of the fistula surgery. So
that's the name I couldn't remember. Right.
Okay. All right. All right. Yeah, that was the second part of this. That was the second part of the surgery. Okay.
Mm-hmm.
All right. And so Tanisha, another kidney warrior who's looking for a kidney donor, she's going to be interviewed this week on Nyanda Laramore's show. And my graft in my arm is also dead. Okay. So if you have had similar things that have happened in regards to either a graft being dead or maybe a fistula that has been stuck too many times, infiltrated too many times, and an aneurysms have happened, please comment. Keep the comments coming in. All right. So I'm bringing the co-host back. We lost her for a moment. I'm bringing her back.
I'm sorry.
While we're doing that, while we're doing now that I've got you back, yeah, in fact, Steve saying sounds like it was a two-part surgery, having to bring the access up closer to the surface. Yes, that's what it sounds like. So, Matthew, now right now your fistula is maturing. That you're having to go through this, and in your latest video, and by the way, I love it how you end with telling an Alexa joke or asking Alexa to tell you a joke. I love that.
She always comes through.
Yes, she does. But so in your video, though, you talked about how you've got to keep your arm somewhat still for about 4 hours. Mm-hmm. Can you talk a little bit more about that? And because I know that you talked a little bit about how that's how your blood pressure is off, and that's probably what's causing the numbness. But why is it that you've got to, keep your arm still for that long? Is it because maybe Steve can answer this because he's watching. Is it because your fistula is so new, or why is that?
And I think he just asked, Steve did, are you using a 16 or a 17 or 16 gauge? It's a 17 gauge right now. Well, they just told me to keep the arm still so it doesn't infiltrate. Okay. And that's when I got to get the kind of the quick horror story on what infiltration was, according to a couple of the nurses there. So, so I'm just super paranoid, sitting there like just with my arm just straight out like this for 4 hours, whatever. And yeah.
Well, I would suggest bringing like a pillow or something to rest your arm on, so that you won't deal with that numbness. A lot of times too, when you move around a lot, it makes the machine beep.
Oh, sure. Right.
Of course, some techs hate that.
Oh, yeah.
They have to come to stop.
There'll be machines going off all the time, and you can just hear the techs kind of just or whatever. And with the chest catheter, so this is actually the second one this go around or whatever. And I had one before, and I guess it had come moved or something inside. And there were so before I got it replaced, the machine would go off all the time. They actually had to send me home one day, without being dialyzed fully or whatever, saying that come back tomorrow. I think I came back to the next day or something like that, which not ideal, but I had to get the fluid off or do whatever needed to be done. But yeah, I've been the one setting off the machine over and over again, and it's a little embarrassing, but it seems like, and in my head, I'm like, oh, every time I do that, I think it's stopping the process. So I have to stay that much longer. So I get paranoid about that.
All right. So
Okay.
I replied to Steve's comment, but Steve, if you are available and if you'd like to come on, just come on over and we'll bring Steve on so that you can talk a little bit more about what we're discussing, because he's got some great knowledge, some great insight about this. So the numbness, and even Tina, his wife, is asking if the numbness will ever stop. So, but anyway, Steve, if you can come on over. You know where the studio is. Just click on the link and come on in. And crush the share button for Matthew. That's right. Smash it. Smash this so that we can get more exposure.
Yes. Share,
so that we can
share.
get this information out there. That's right.
Please and thank you. Yes, that'd be so awesome.
Yes. So continue to comment.
I know that when I was on dialysis, I had numbness, but it would mostly come when my blood pressure was unstable. It wouldn't be like a constant thing, but when my blood pressure was either low or high, I have some numbness. But I would just hang my arm over. I don't know what kind of chairs you guys have, but I would hang my arm over the chair, and like I had a blanket. That's why I said maybe like a pillow or something under it, so you won't have to just keep it straight, just hanging there.
That's a good tip. That seemed like it helped you.
It did. When you've been there for 6 years, you start to find little things that you have to do to make yourself. For one, it's always cold, freezing cold.
I was in my shorts today. I was freezing. Oh yeah.
Yeah, no matter how many blankets you have, you're going to be cold.
You're still going to be cold.
Yeah, it's like after years of being there, I had like a whole big bag that I accumulated to take with me when I did go. But those were the things that I knew that I needed to be comfortable while I sat there for 4 hours. So, yeah.
Yeah, I normally do have a bag with my blanket, and I didn't bring it today, and I haven't brought it the last couple of times. And I always walk out there going, "Bring the darn blanket. It's cold in there." And they told me when I first started that it was a good idea to have a blanket because it gets cold. Most patients bring, and I've been forgetting it, and then I walk out there freezing.
Do you go to a DaVita?
It's no, it's
Fresenius?
Fresenius, yes, ma'am. So there's two of them here in town, and I go to yes, ma'am. So I go to Fresenius.
Okay. So they didn't supply you. I know all the DaVitas I went to supplied me with a bag with headphones and a blanket and all of that stuff. So they don't supply that at Fresenius?
No blanket. I got a headphones, and I've lost them and got replacement on those, but no blanket. So and when I forgot my blanket, they're like, "Oh, we can get you a." And I'm not talking bad about them. I mean, it's my bad not remembering the darn thing. But we got a sheet, or we can give you a gown or something like that. Would you like something? It's okay. I'll just grin and bear it. But yeah.
Yeah, like the gowns that they wear. I've had to use them a couple times. So
Right. And maybe I will. It'll get cold enough where I'll take them up on the offer, but I haven't gotten there yet. So yes.
Okay.
DaVita hands out goodies. That's what I just heard somebody.
DaVita does hand out a lot of goodies.
I didn't get any goodies. No, I just
every
get
holiday.
Yeah. See, well, I haven't been there for a holiday yet, so we'll see.
Every holiday we got treats, or we got like I have DaVita headphones. You can see them.
Okay.
I have DaVita
We'll see.
headphones. I have water bottles. They
Well,
did give out a lot of goodies.
so actually, I take that back. So I just had a baby about 5 months ago, and they did send us a box of diapers
Okay.
with a card. So yeah.
Awesome.
And they all signed it, which was really nice.
That is nice. Is Steve here? No? Okay.
Jared,
I think maybe.
Jared is frozen.
I think he is maybe talking to somebody. I did hear somebody else
Oh,
come
okay.
back come on. So
Okay. So you've always went to Fresenius?
yes,
Even when you
ma'am.
were on dialysis before you went to Fresenius?
No, actually, before it was DaVita. So back back 04, I'm sorry, 02, 04 is when I got the transplant. I was on DaVita then. So,
Okay.
and I don't remember them giving me goodies there either. So I don't know if I just missed out on that.
I think it depends on the actual facility.
Okay.
Not all of them that I've been to have, because I when I was on dialysis, I traveled a lot.
Okay.
So when I traveled, I had to, set up my dialysis. I don't know if you've ever traveled while you were on dialysis, but I had to set up. Yeah, it can be a lot, but I had to set up and get cleared to come to the center before I even traveled. That was very if I couldn't get approved at a center, then I would have to find another one and things like that before I even traveled. But I did still travel a lot. But visiting different centers, it was, different at each one. So, yeah.
hello.
Hi, Steve.
Hello, everyone. Can you hear me?
How you doing, sir?
Yes, we can hear you.
All right. Jared, can you hear me? I think Jared, something might be wrong with his speaker. So Matthew, how's everyone doing?
Good, thank you. Thank you for asking. Nice meeting you, sir.
Yeah, it's good to join the conversation. I know you had mentioned that you had just got your access, and what I was saying, where that numbness is coming from, is when they did the surgery and they connected your veins, they did some cutting, and so your access is stealing a lot of that blood away, from which that blood would normally go down to your lower extremities, to your fingers.
Yes,
so
sir.
you're probably numbing the fingers because the access is stealing blood away from it to go through the access.
That's
so
what
it's going to reduce it.
Okay.
And so, if that continues to happen, you can talk to the surgeon. You can go back and talk to the surgeon and ask them what do they suggest for that. What we tell patients to do when they come to treatment, if that normally that happens during the treatment, because when you're on the machine and the blood pump is pumping, it's pulling the blood out and it's going through the machine. So that also one of the reasons too. But what you could do is bring a glove to dialysis and put a glove on your hand or a mitten during treatment, and that seems to help. And someone mentioned Still syndrome, and that doesn't always happen, but some people do get Still syndrome. But in your case, I don't think that's Still syndrome. So yeah, and also when they was telling you about keeping the your arm straight, normally what happens when you're moving your arm, like if you're trying to adjust the television or you pulling the blanket up or something, if by chance you bend your arm a certain way, depending on how that needle is inserted or the angle that is in your access, it can infiltrate your arm. And normally what happens when that happens, blood goes through the access out that hole and into the surrounding tissue and cause a hematoma. It starts to swell and get really tight.
Okay.
And so what we tell patients to do, soon as you get home, put ice on it immediately. 24 hours. Once after that, you put a heating pad on. And what the heating pad does, it draws the blood away, the hematoma away much faster. And no, Still syndrome is not from years of dialysis. It's from a surgery that the surgeon creates, and some way with the surgery, it causes pain in the arm down at the access. So it's not from years of on dialysis.
Okay. Yeah, that's how it was explained to me. And again, it freaked me out at the beginning or when it first started happening. And because it was happening, the numbness in the finger. The first time I recognized it, I was out to eat with my wife and daughter. And I think we had a baby with us. And we were just eating. And my fingers are starting to go numb. And I look over and they're like ghost white. And I'm looking at the tips and I'm going, what's going on here? And I started to try to do the massage thing or whatever, and it lasted for about an hour and a half to 2 hours. And that first time it ever happened, it happened like that. Normally when it happens, I can massage the fingers or kind of do this thing, and it kind of goes back to normal. That time I was like, yeah, I'm sorry. It was blue at one point too. So yes,
Wow.
So let me ask you, Matt, these some things you got to some things you got to think about. One, do you have diabetes?
No, sir.
All right. So with many patients on dialysis, not talking about diabetes, but a lot of patients have what's called anemia.
Okay.
And so, that's a low blood count.
Right.
So if you have that can be a factor because your heart, you don't have a lot of red blood cells and your heart is not, pumping out those blood cells, or your blood cells is not being reproduced like it should because of kidney disease. So that intel can contribute to the numbness as well.
Okay.
But the main thing is the access.
Okay.
Let me ask you, do you have a straight AVF fistula? Is it straight, or is it a loop, or is it curved?
You mean like as far as the actual fistula, the vein or whatever? Oh,
yeah.
It's kind of it's straight-ish, but it's kind of a straight. Yes, sir.
Okay, and then I can't see her name. I'm sorry.
It's Tanisha.
Shalia.
Hey, Tanisha.
Oh, I thought
And-
you were
and just-
okay. I thought you were talking about the comment. My bad.
No, you guess.
Yeah, Shalia.
Oh, Shalia.
Oh, Shalia. Yeah, and just like she mentioned, Matt, you want to be careful with the technicians or the nurse when they sticking you with the needles. Not too close. You want them at least when they stick the first needle, which is the arterial, you want that to be lower, and you want the venous needle to be higher.
That's
you
what
don't
they
want
do.
them to be really close, like she was saying, because if those needles are close together, it can cause recirculation, meaning your blood could start mixing up and you're not getting a good dialysis. Then also to prevent the aneurysms, what you want to have them do, like Shalice said, not have them stick in the same spot. So wherever they stuck today, or if you went to dialysis today, say at the bottom where they stuck, have them go 2 finger widths from the last scab.
Okay.
Wherever it's scabbed up at, go 2 finger widths from that last scab to stick the next needle on both sides.
Okay.
And it's called like the ladder method, almost
Ladder
like
method.
leapfrog. And
Okay.
you want to go up your arm like that and then come back down and go back up again, because if you stick in the same spot, what happens, how that aneurysm is created by sticking in the same area, you got all that velocity of blood coming through your arm because it's pumping from the heart, it kind of expands the skin. Okay, so you sticking in the same spot, that area is getting weak. The skin is getting weak. And so that high velocity of blood coming through there is going to like expand that that area. Okay. All right. And then that's where those bumps come from. You see people around with those knots and they sticking on the side and around because now you done stuck at that same spot so many times. That area, you don't weaken the area.
Is it like scar tissue?
No, but scar tissue can build up.
Okay, yes, sir.
And someone was asking about the buttonhole. Yeah, you can stick in the same spot if you create what's called a buttonhole, but in order to do that, you need for them to develop the track. You know, with the surgery, when you first got the surgery, you know, that should have been mentioned. And then what happens, you need someone at your facility, a technician or a nurse. They normally what's called they start the track, what mean is they stick in the same spot each time, creating a tunnel. And so a scab forms over it, and you pick like these needles come, they call blunt needles, and they got this little pick piece on it, and you use it to pick the scab off after you done disinfected the arm and the area. You pick the scab off, and then you stick the needle right in that hole. And in that case, that doesn't cause aneurysms.
That sounds terrifying.
No, but it sounds like it, but for the most part, it's a good site where you go each time, and you can even stick yourself. Mm-hmm. A lot of people stick themselves. They got buttonholes because it's in the same spot. But you just got to have somebody to create that track. The same person has to continue to stick you until that track is created.
Okay. Something to think about. I again, with everything with needles freak me out. So any kind of I don't look. That's the thing that's helped me the most. And I don't want to, I don't know. But and maybe that's something.
Your catheter?
Yes, sir.
When are you getting that taken out within the next week or two? Because are they using 2 needles in your arm, or are they doing 1 and 1?
They started with 1 and 1, but they're doing 2 needles now. But they haven't told me. Well, actually, they have said today. They said, because I went to dialysis today, that I'll be graduating in a week because they've been successfully using the 2 needles. And that when they say graduate, they mean they were talking about moving to a bigger needle. So they're at a 17.
They're going to bump you up to either 16 or 15 gauge.
Oh, geez. Okay.
I thought I had one. I do have one here, but it's in my my bags and stuff. But
we don't want to scare him.
Yeah.
Well, no, but I mean, you want to know what you're coming into.
Getting into, right. And I have an idea.
It's not scaring you, but I mean, it is what it is, and eventually it's going to come to that.
Sure.
But if you know beforehand what you're going to be dealing with and how to deal with it, then you be prepared.
Okay.
Once you get there. One more question, Jared. I'm not going to take over your show. What size dialyzer are you on? Do you know your filter?
I didn't know. I guess I didn't realize there were different dialyzers or different sizes. Yeah. So I didn't even think to ask or look.
Yeah, definitely. Let me just say this. When you go there the next time, just find out what your orders are, like what size dialyzer you're on, because, we can get caught up in going to treatment thinking everything is the same. Yeah. And, the staff could be setting up and they could set up the wrong filter for you, right, and you may not realize it. I'm not saying they would do it, but it happens.
I got to check them every time and ask them what my dialyzer size is.
Well, no, you could just ask them what your dialysis orders are.
Okay.
I mean,
Right.
what size dialyzer you run on, what your blood flow rate is, how
Okay.
much heparin you get, what your
Okay.
dry weight
Right.
is. It's just some, stuff that you should know as a patient starting dialysis, what to look out for, because we're setting in machines and we're human.
Yeah.
And to err is human. We can
Sure.
make mistakes too.
Right.
So if you got a new person starting working in dialysis and they assign that person to you, and they short of staff and they put you on dialysis, and you're supposed to be on a 350 blood flow rate, and they still have you on a 200 blood flow rate, and you done did most of your treatment, you didn't really get a good dialysis treatment.
Okay. Okay.
You know
Right.
what I'm saying? So
No, it's good. That's good information.
I mean, you got to know that, because you got people who, I mean, I'm one of them. I used to be one of them that come to work and do what we're supposed to do. But, nowadays it's short staff, people working 14, 15, 16 hours. And at the end of the
Right.
day, I'm not sure when your dialysis shift is, but I'm sure that it's almost like when you see the changeover, it's like a rush mentality. Like patients are coming off the
Yeah.
machine, people are going on. It's almost like a chaotic scene.
Yeah.
Okay.
Is that-
I'll
now,
look
is that-
into it. I'll look
Is
into
that
it.
how it is at your unit?
At my well, I get there at 3-ish or whatever, and I guess I'm the late shift, and I think they've done most of their changes before I get there. But I've heard that because the late shift, because it tends to be kind of quieter, so I think I miss on that rush, which I've kind of heard about or whatever, with people coming off machines about the same time, and I guess like you're saying, some of the staff leaving and coming in and stuff like that, and it sounded like it's kind of crazy there.
Yes, I can attest to that. And I
She
also
can
want to
attest to
say,
it.
I don't know if Fresenius does it because I've never been there, but DaVita, like they have I don't know what the sheet is called, I can't remember. But it has like all your orders and stuff on it.
Okay.
It's the rounding
Look at that.
report.
Okay.
Right. Look at your machine. I've been in these where I had to disconnect myself, and because I'm mobile, I helped disconnect others. But I knew my machine, and I knew
Okay.
what to do. And like Steve, they hook up something wrong. You knew, hey, this is not what I'm supposed to get. Know your medications. Know what they're giving you. If you don't know, ask, because sometimes they might mistakenly give you the wrong medication. It's just good to just know the machine, read your sheet. I call it a flow sheet. Read your flow sheet. Know what your dry weight is. Know your settings on your machine, because people are human. They make mistakes, and there's nothing wrong with you checking that stuff.
Right.
I've had
Nothing wrong with it.
techs get upset with me like, well, why are you looking at that? Because it's my right. I'm the patient. This is
Exactly.
my
Yeah.
body. And I'm going to make sure that things are okay so that nothing further, happens. So get to know that machine, ask questions. There's nothing wrong with that, because
Nothing
that's
at
what's
all.
saving your life, basically.
Yeah, I do get a or I call it a report card. So it's basically what my numbers are, and
Right.
one of the numbers in particular. And I think Steve brought this up earlier. He was asking me if I was anemic, because he was
Right.
referring to the fingers being numb
Yeah,
or
the
something.
numbness.
I have a low, I believe it's hemoglobin. Is my
Yes,
hemoglobin
that's the
low?
low iron. Yeah.
And so I actually had a blood transfusion not long ago, or before
Oh, wow.
dialysis. So yeah, because of that. And the numbers are good. They came back with the numbers today and said that's good, and some of the other ones are good. But yeah, so I've had low blood or hemoglobin. So I don't know if that has anything to do with the numbness in the fingers or not. So again, he was talking about anemia, and it could be just two different things. But
No, anemia has to do with your hemoglobin. I actually was just hospitalized for that.
okay.
So it does have to, once, well, you've been trained it, but my blood work came back and my hemoglobin was really, really like extremely low. And it had
Okay. Yeah.
dropped low from like a week. So yes, that's hemoglobin iron. Yeah.
Yeah, mine had gone down to like 7 or something. I think it's 11 or 12 now or whatever, but it had gone
Yeah.
down. I think
Did
Once
you
you
hear
hit
his?
7,
Did you hear the question, Steve?
I'm sorry.
Did you hear his question about the hemoglobin and the
No.
anemia?
So I was asking if, because you had mentioned something about if I had anemia because with my fingers going numb, and I believe so, but I know for a fact that my hemoglobin was low there for a bit, and actually had a blood transfusion. I went to the ER a few months before I went on dialysis, and they got it. It's up okay now, but for a minute there, or for probably a few months, it was a dangerous number from what I hear, like a 7 or something like that, I believe.
Let me ask you, did you just start dialysis?
No, I've been on it for about 10 months.
Okay, 10 months. Okay.
Yes, sir.
So also if you see your blood count start to drop, just check your stools often to see if they dark or
yes.
tarry.
Okay.
Because with some
Yes.
patients with kidney failure, you have GI bleeding is common.
Oh,
Oh wow,
Right.
wow.
Also, is your catheter like this?
yeah, something. Yes, sir. Yes, sir. Yes, sir.
Like this?
hmm
So, also, I just wanted to tell you while you're at treatment, they should be changing once. Even though you're getting cannulated in your arm, they should be still changing the dressing each treatment.
They have been. Yes, sir.
Okay.
And they actually changed the. I don't know. I don't know if they're flushing it. I think they flush it as well.
Yeah. What they
And-
do is aspirate and then flush it to make sure to see if it's still working.
they
Because
do that.
one of the reasons why, excuse me, one of the reasons why you still had that catheter in, because they want to make sure your arm is working. Also, if there's any issues, like if there is an infiltration where, say, if they putting the needle in the venous, the top needle, and that infiltrates, and they can't use it, or there's no more space, because when you get infiltrated in the venous, you got to go above that infiltration site, so not to put more blood into that area. But if you don't have no more space to go, then they can disconnect and use the blue
graft.
part.
Right.
They can use the venous part of the catheter, Jared, and use it as the return. So they got one needle in, okay, one needle,
Right.
the arterial needle, which is still working. The top needle is not working because let's just say it infiltrated.
Okay.
And he don't got no more space to go up top. Now he got his catheter. He doesn't have to go home and come back tomorrow. We can just go and just use the venous port of the catheter as the return line and continue dialysis.
So
as
you
long as
wouldn't
I've
have
still
to
got
go
the
home.
catheter, of course.
Yeah, as long as you still got the
Right.
catheter. But that's what I'm saying. This is that window, because this when a lot of patients, when they get newly developed accesses, they kind of had their common problems in the beginning.
Okay.
Because you had mentioned about your access was a 2-part where they had to transpose, meaning bring it to the top.
They
so
did, yes.
evidently, when they did the surgery, see, Jared, this is what I was talking about with a lot of these surgeries, is why they didn't put it at the top in the beginning. Why did he start from the bottom and then have to transpose to the top when they just could have put it at the top in the first place? Just like when Shalif was talking about, she had her access at the bottom portion.
Right.
Like
You mentioned that
the
earlier, right,
radial
Shalina?
portion of the
Yes.
arm. And so what it sounds like happened, she mentioned that it stopped working because if it infiltrated, and with African Americans, our veins are normally small. So if it infiltrated, the infiltration could have compressed on the veins and caused the blockage. Any type of compression, like if a person sleeps on the arm, because they tell you don't sleep on your access arm, don't wear no tight jewelry, don't wear anything that's going to compress or
Compress.
restrict the flow
Okay.
of blood.
Mm-hmm.
So that can happen with an infiltration. The infiltration can swell up because it's blood going into the surrounding tissue. Now it's going to compress that vein and cause it. If it compressed, then blood can't flow through it. And so then it's going to stop working because it can't get through.
Okay.
But see, a lot of
Interesting.
patients, a lot of the nurses don't explain this in detail. They just, oh, it's not working, or this happened, and then they send them to the access center, or they got to make
Right.
an appointment with the surgeon. With the
Right.
surgeon or something like that. Not really explaining the cause and effect of why this happened, and that's why I do what I do, man. Because I seen patients
seen
with
it.
3, 4, and I'm not saying this to scare you, Matthew, but I've seen patients with 3, 4 accesses because, again, mostly minorities because they got small veins. They start at the bottom wrist. It's not working. Now they go to the top part where you got the larger veins, 2.83 centimeters in diameter in width. And so why didn't you go up there first? That's my biggest issue with surgeons. Why you didn't start with the larger veins first?
Initially, yeah.
Yeah, initially, where if why does it take 3 accesses to get it working when you could have started with the third one, knowing that where the most bigger veins are? And see, that's the thing. There's no refund. If you go and they mess up your arm, there's no refund on
Sorry, Charlie. That's it.
on insurance. You
Yeah.
got to suck it up and go to
Right.
another spot. And I saw one of your guests, that girl Nee,
Yeah, Tanisha.
said that she has 3.
Right.
She has
right.
3, yeah.
Yeah.
Something like that
again, Jared,
actually happened to me with my second fistula. I initially went in, the doctor told me that he was going to do it at the top of the arm. And when I
Okay.
got there, tried to do it at the bottom again. And I said, no, that's not what we talked about. It's not us.
and
He
see,
was like
Jared,
upset, but I said, this is what we discussed when I was in your office for the consultation, and you showed me the veins and told me that the veins were bigger in the upper arm. So now when we get to about to do the
Wow.
surgery where you're marking my
Wow.
arm, you're trying to tell me, oh no, the veins at the bottom are better.
Wow.
And I said, no, that's
That's
not what
exactly what
we're
we were
doing.
talking about, Steve.
yeah,
Yes.
Jared, that's why I do what I do. And a lot of people, I know it's a lot of method to my madness, but shows like this and what we do is the reason why this information is so important. So, and that's why I
Right.
wrote the book, Jared. I don't know if you have it, a copy of it, but that's why I wrote the book, How to Survive Outpatient Hemodialysis, a guide for patient with kidney failure. Because if someone knew, like if they go to the hospital and they find out they got kidney disease, right, and they get ready to start dialysis, it's a Friday and they start outpatient treatment Monday or Tuesday, they don't know what to expect. It's
Right.
the unknown
It
coming
is.
up. You've never been in a
It
dialysis
is.
clinic. You don't know how it operates. You don't know who works there. You don't know anything. So that book takes you, soon as you open the door, what to expect, the admission process, what to expect, what papers to sign, your weight, meeting the staff, getting your blood pressure, sitting, standing, and your temperature. Just knowing what to expect. So once you get there, I mean, it's not going to knock off all the anxiety that someone may experience undergoing a new medical procedure 3 times a week. It's not going to take all that away, but the better that a person is prepared to start this treatment and come in knowing, like for instance, most patients don't know when they start dialysis, when they come in on the first day, to bring a blanket, maybe bring some
Right.
headphones or
Right.
bring something to read. And the blankets, because they don't control the temperature. It's normally cold, and a lot of people complain about the temperature in the dialysis clinic. I mean, some patients say it's too hot, some say it's too cold. The patients say it's hot. They're walking around with lab coats on, PPE, and they working
Right.
and they start to
Right.
sweat, and so they may turn the temperature down to make it cool. And so you have a lot of patients that can't take that. Then when you're on the machine, your blood is coming out and it's recirculating outside of your body. So
Mm-hmm.
they won't know that the first day to come there to bring a blanket. So they may say, "Oh, you got something I could cover myself up with?" And 9 times out of 10, we gotta give them a lab jacket, and they don't do any good, but it helps. But that's a big thing. What to bring on
Yeah,
your
I
first
needed that
day?
book when I started because I went in blindly. Nothing was explained to me. Like I sat in the lobby for about a half an hour
That
before
could have been
somebody
useful
asked
for you.
me. Yeah,
Yeah.
yeah.
So Matthew, I'm not going to stay on here long, Jay. I'm about to leave. I just wanted to, because he had the access, and Jared, that's really dear to my heart, the education, and doesn't matter what color a person is, dialysis
Mm-hmm.
is dialysis.
Right.
And I just want to make sure everyone knows when they go in their door, they got this access or they brand new to this. I don't know everything, but what I do know, I just hope that it will help patients when they start to help them with their quality of life, and not and able to avoid a lot of the pitfalls that some patients weren't able to avoid
Mm-hmm.
because they didn't know this information, what I'm saying or whatever. They go to the surgeon, and like Shalif said, they talked about doing the surgery up in the upper arm, and now they go back, it's something different. And if she didn't stand her ground, right, there's some people that would have folded and said, okay, the doctor probably knows what's best, did it again, and maybe would have the same issue. And then what you gonna
Right.
do then? You got the same issue, you go back. Again, there's no refund. What can the
There's no
doctor say
refund.
but, "Oh, I thought it would work"? But that doesn't help the patient. The
Right.
patient's the
Right.
one going to be in pain.
Mm-hmm.
So where can we buy your book?
So you can get it. I know Jared showed it on Amazon, but actually you can go to my site, www.stephenlbelcher.com.
Okay.
All
Yeah,
right. Let me put that
that's
in
a
there.
V.
Stephen Belcher.
No, L. That's an L in
L
the middle,
Belcher.
Jared.
L Belcher. Right. Okay. So that's
Yeah, I mean, you got to do what's best for you.
StephenLBelcher.com.
Mm-hmm.
Okay. There
Yeah,
you go.
that's it.
StephenLBelcher.com.
Yeah. So Jared, man, y'all, it was great talking with y'all, meeting you,
Yes.
Shalif and
Thank
Matthew.
you for your
Thank you, Steve.
information.
Thank you for the
Go to,
info.
if you can,
Yes,
you
sir.
can go to my YouTube channel, Matthew,
Yes, sir.
Steve the Kidney Nurse. I got a lot of great videos that you can watch if dialysis education, like on MRSA, emergency evacuation, a lot of great stuff on the machine, how it works. Great information, guys.
It
So
is.
sir.
Thank you. Thank you. Very
yeah,
thankful for
good
you
Thank
topic,
coming
you.
on.
Jared. Great show, man.
Ready.
Thank you,
Yes, sir.
Steve.
All
Thanks
right,
for
y'all
coming
guys,
on,
take
jumping
care.
on.
Yes, sir.
You
Bye-bye
too.
now.
All right.
Thank you.
All right. So Shalia, I want to thank you for coming on. You've been a great co-host. Your knowledge, your experience has really added to the show. So I'm extremely thankful that you've come on tonight. Thank you so much for
Yes,
doing
thank you
that.
for having me. Thank you for it was definitely a
I would
great
have
show.
I would have been more prepared to show Steve's book with a little graphic like I have yours. But now, before I let you go, I'm going to show the graphic one more time for your book, The Purposeful Positivity Journal. You can buy this on Amazon.
Yes. So that I wrote that book. The reason why I wrote that book, and then I'm gonna go, is because when I was first told that I had kidney disease, I became depressed. Being on dialysis was depressing, but I always said that I'm not going to let this take me into like a deep depression. So I started reciting affirmations. And the
Nice.
affirmations helped me to stay positive. So what I did is I wrote this book for anyone who is diagnosed with a major medical illness, dealing with it, is going through like loss, mental health. This book can help you to stay positive. So
Nice.
that's what has helped me, and it's still
Awesome.
helping me even through like the journey of getting the transplant. Because when I first plant, the pain that I was in, I was telling myself that it wasn't worth it. I said dialysis wasn't this bad. So you can get into that and be in your head and get depressed. So
Yes.
yeah.
Positivity, man. I love it. That can help us in everyday life, regardless of your condition, your status, or whatever may be happening. And I think that's awesome. I congratulate you and commend you for doing that.
Thank you.
That's awesome.
Thank you. Yes. Thank you for having me on. And Matthew, please keep us updated about your wife and what's going on. And we're rooting for you, praying for you, and keep fighting.
Thank you so much, Shalia. Thank you for co-hosting.
You're welcome.
Yes, ma'am.
Have a good one.
Thank you. You too. God bless. Okay.
All right. Thanks. Bye.
Bye. All right. Keep in touch. Bye-bye. Hey, I want to give a special shout out to David Pollock, who's watching. Wonderful chef, and I really appreciate him following and chiming in. So I'm going to put your information up one more time, Matthew. Here we go. So what I'd like to do is, much like we did the last time, is what would you like to say for anybody that may be watching, anybody who has ever thought about donating a kidney, or anybody who may be going through what you're going through? What would you like to say, and whom would you like to shout out in regards to being in your corner, or maybe giving your thank yous?
Yeah, as far as anybody who may have questions about becoming a donor or knows somebody, I can't begin to say that I understand what that process looks like, or whatever. I can tell you what I've seen or heard, and I can be help you there. But if anybody has any questions and wants information, they can go to that website that you put there. I also have a Facebook page, Matthew's Kidney Search, that I put videos and stuff up there too, and post. And I'm just I think this is it can be scary for both recipient and donor. But again, with social media and everything, it doesn't have to be something that somebody goes through alone. Again, whether they're being a donor, or whether they are a recipient. And I didn't have all this stuff back in 02, 04. There was no such thing as Facebook and all these groups and all these people reaching out. So it doesn't have to be done alone. So please, anybody that has any questions, please reach out, and thank you for watching. And thank you for letting me be on your show, Jared.
You're welcome. You're welcome. Man, I enjoy your spirit. I think that you're a fighter, and you have so much love, Matthew, so much love for your family, for your wife, and everyone connected to your family. And so I'm rooting for you. I'm in your corner, and please keep me updated on how things progress. I'll be obviously connected to your Facebook page that I just put in here so that people can find it. Matthew's Kidney Search. Yeah, I'll keep following that and keep me updated if if something progresses well. Okay.
Okay, absolutely. Thank you again, Jared.
You're welcome. God bless you, brother.
All righty. You too. God bless.
Bye-bye.
All right, bye.
All right, there we go. I pressed the wrong button. You almost went solo.
Oh, are we still live?
Yeah, we are. I
Okay.
accidentally took myself off instead of you. But anyway, thanks
This will
again,
be the
brother.
outro. Yes, sir.
Right. All right. So I pressed the wrong button. I've been doing this for a while, but every now and then you do that. Okay. But I want to thank everybody for watching. All of Matthew Novelli's family, Tina. I want to thank Tanisha for watching. David Pollock for watching. I know I'm going to miss some people. So Julie Nichols, Jonathan Traylor, Steve Felcher, of course, Shane Blanchard, and wonderful comments from Joe Ellen. All right, I know I may be missing people, and also just people that maybe were watching that didn't comment. Thank you for watching. All right, so please share this so that we can get him more exposure and make sure that we get his information out there. Okay. Anyway, I appreciate your following. Thank you for allowing me to spotlight each person that comes on and give them a chance to find a living donor. Thank you. Have a great evening. All right. Oh, thanks, Mark. Mark Williams. Thank you. Thanks for tuning in, Mark. And I appreciate you saying that. Thank you for sharing. For anybody who's clicked the share button, it is gold. All right. Thank you for sharing. All right. I'm going to find that outro. Thank you. Have a great evening. Peace. I'm out. Peace.
Check the mic and make sure it sound right, boys. It sound right, boys.